December 2019, a pneumonia-like respiratory illness was first detected in Wuhan, China. Chinese authorities identified that the illness was caused by the new coronavirus, and later on, with additional cases being identified in a growing number of countries internationally. Earlier last week, the Department of Health confirmed the first case here in the Philippines, and the health agency is on high alert for the 2019 novel coronavirus. What is 2019 novel coronavirus, and how does it differ from other respiratory illnesses? This morning, we will get to know more about this respiratory outbreak with the help of a medical expert, only here in Doctors on TV. Our guest this morning is an infectious disease specialist. He is an active consultant and residency program training corps at the Metropolitan Medical Center. He is also an active consultant and assistant professor at FEU NRMF Department of Medicine and Department of Physiology. He is a visiting consultant at Philippine Heart Center, Olivares General Hospital, and Protasio General Hospital. And he is a medical specialist 1 at Hospital ng Parañaque. Please welcome Dr. Endimion Irvin Monzontan. What is novel coronavirus?
Itong bagong novel coronavirus na natatawag natin 2019 Ncov, isa siyang viral infection na pwede mag-cause ng mga respiratory symptoms katulad ng ubo, sipon, trangkaso at lagnat. Ang pagkakaiba niya dun sa mga dating coronavirus na infections katulad ng SARS in 2002, the Ncov, yung Middle East naman, is in 2012-2015 during that era. And ito naman is 2019, no, na usually the first cases they found out sa December of that year. So timeline pa lang, iba siya. Ang similarities naman, okay, would be the definitive host, okay? Kasi most of these coronaviruses, same symptoms, tapos meron silang zoonotic na origin from the word zoo, meaning the animals, no? So, ang bat o yung paniki, okay, would serve as a common definitive host of those three. Kaya lang dun sa intermediate host, ibig sabihin dun sa paniki, isasali nitong virus dun sa iba pang animal, sa SARS, sa civet cat. Yung sa MERS, dun siya sa camel. But for this 2019 novel corona, wala pa silang napipinpoint kung ano talaga yung intermediate host. So, most likely this is another animal. Okay? So, wala pang masyadong natutuklasan as of this point in time.
How does it differ from SARS and MERS-CoV?
Yes, meron silang similarities. In what way? Because we have found out, or scientists have found out, no, na yung kanilang definitive host, okay, would be the bat, yung paniki na tinatawag. So most of the cases of these coronavirus infections, paniki yung similarities nila. But yung intermediate host, pwedeng magkaiba-iba. Like itong SARS, ang intermediate host niya would be the civet cat. Itong MERS, itong Middle Eastern naman, the intermediate host would be the camel. But for this one, the novel coronavirus, itong intermediate host, wala pa talagang silang pinipinpoint kung anong intermediate host. This can be another mammal, this can be a reptile like a snake or what. So wala pa silang pinipinpoint. Differentiation, actually walang masyado because the signs and symptoms, okay, would almost be the same. Very non-specific. Pwede siya magkaroon ng trangkaso, ubo, sipon, lagnat, pagbabahing. So almost the same actually.
How was novel coronavirus discovered?
Last year in December, okay, 2019, there was like parang may mystery disease, no? Yung mga tao in China, biglang nagkakaroon ng mga pneumonia, leading to parang massive na outbreak doon. Tapos na-found out nila may mga namamatay din. So of course, they have to do something about it, okay? So those patients underwent testing, hospitalization. They found out na, oops, mukhang may bagong strain nga to, no? So, until naging, naging mas sikat siya because hindi lang siya naging sa China lang. So, we already have cases, okay, all throughout the world. Maski na sa Europa, sa Asia, sa Philippines, in fact, okay, sa Singapore, Thailand. So, kaya siya naging mas, very controversial right now and it is like the talk of the town ngayon, no?
How does the virus spread?
ang transmission of this infection is usually respiratory. Pag sinabi natin transmission, paano siya nahahawa sa iba? So, pag sabi ko respiratory, ibig sabihin kapag bumahing ako or umubo ako, tapos hindi ako nag-cover ng mouth ko, itong maplema ko with this virus, with this infection, pwede siyang pumunta sa ibang tao at nalanghap niya, napunta sa mata, sa mucous membrane o kaya dun sa bibig, sa loob ng labi, pwede kang mahawa. Kaya lang, little has been known pa, no? Konti pa lang masyadong may scientifically na napag-aralan kung ano ba talaga itong klaseng virus, gano'n ba siya katindi, gano'n katapang. That's why in the hospitals, nagpa-practice kami ng one step higher na precaution. Kasi pag sinabi natin droplet, in fact, pag ako nandito, tapos meron akong taong at least 1 meter away from me, hindi na dapat ako nakakapag-transmit ng mga droplets sa kanya. But sabi ko nga, little do we know pa if how virulent, how matapang this virus is going to be. Pag nasa floor na siya, okay, baka kapag nahawakan mo yung floor, you can still be infected. That's why yung mga frontliners, especially yung mga nag-work sa hospitals, dealing with such possible na Ncov patients, they have to wear proper protective na equipments, katulad ng mga N95 mask.
What are the symptoms of the 2019 novel coronavirus? And who's at risk of getting this kind of disease? Hear the answers from Dr. Andy Miontan after a few reminders. Doctors on TV will be right back.
Nagalok ng tulong kamakailan ang Philippine Genome Center o PGC sa pagsusuri kung positibo sa 2019 novel coronavirus ang isang person under investigation. Base sa kanilang statement, handa silang tumulong sa Research Institute for Tropical Medicine para ma-verify ang suspected 2019 Ncov cases sa Pilipinas. Ayon pa sa PGC, may kakayahan silang i-validate ang mga nakuhang sample mula sa pasyente gamit ang kailangang mga equipment at trained DNA sequencing staff and scientists. Ngunit ayon sa PGC, wala pang abiso ang Department of Health kung gagamitin ang kanilang serbisyo dahil wala pang go signal mula rito. Matatandaang itinayo ang PGC sa kasagsagan ng Severe Acute Respiratory Syndrome o SARS noong 2003. Layunin nitong makapagsagawa ng DNA sequencing upang hindi na ipadadala pa ang mga sample sa ibang bansa.
What are the symptoms of the 2019 novel coronavirus?
Ang symptoms ng itong coronavirus infection, itong bagong coronavirus, would be almost the same as the other coronavirus infection. Parang din siya yung mga common cough and colds, no? So, trangkaso, lagnat, masakit yung katawan, ubo, sipon. Very important para natin malaman if this is a 2019 novel coronavirus is we should always ask yung isang patient ang kanyang history of travel. Kasi meron po tayong ginagamit na algorithm, no? O yung direksyon kung paano i-guide kung ang isang pasyente ba ay malilabel as PUI or PUM. Pag sinabi kasi natin PUI, this is a person under investigation. Okay? Pag sinabi natin PUM, this is a person under monitoring. So we should have the questions, katulad ng lagnat, meron ba siyang ubo at sipon, meron ba siyang exposure sa isang confirmed case, at saka meron ba siyang history of travel within the past 14 days. Next question, travel saan? Sa China, including Macau and Hong Kong. So if pasok siya dun sa criteria, then we say that this person is a PUI. If hindi siya pasok, for example, history of travel lang to China, wala siyang symptoms, walang lagnat, walang ubo, walang exposure to confirmed case, hindi siya PUI. PUM lang siya. So, person under monitoring, home quarantine for 14 days. Okay? Pero pag PUI, kailangan siyang i-admit at kailangan nating i-test. Dito na sa test magkakatalo at malalaman natin if this is a coronavirus na 2019 novel corona na strain or hindi. Because we have the test kits.
Who is at risk?
Actually, anyone can be infected. Okay? But yung mga mas nagkakaroon ng complications o yung mga nagkakaroon ng pagkakasawi, okay? Yung mga mas namamatay, no? Mas prone sila doon if extremes of age. Pag sinabi natin extremes of age, masyadong bata at masyadong matatanda. But we also have to look into yung kanilang health, okay? Health status. Meron ba siyang underlying na diseases? Meron ba siyang diabetes? Baka naman may problem din siya sa kidney. Baka may problem din siya sa immune system, HIV or cancer patient siya, we do not know. But those patients, we are quite sure, no? Those patients na may mga underlying na sakit, extremes of age, talagang sila yung mas prone na mahawa at magkaroon ng complications.
Among coronavirus, SARS and Ncov, which is the deadliest?
Actually, sabi nga nila, yung MERS, no, mas madami pa nga nasasawi or namamatay kaysa dito sa novel corona. But again, konti pa lang yung nalalaman natin about this novel. Kaya novel, bago siya. So, scientists and doctors, researchers are still doing all those studies right now. But meron tayong isang pwedeng point of comparison. Okay? I-compare natin tong 2019 novel corona sa ibang viral na infection. Narinig niyo na ba yung measles or tigdas? Okay? Pag familiar sa mga audience natin ng measles or tigdas, ang measles meron siyang tinatawag na RO na value na around 15. Ibig sabihin yan, gaano ba kabilis makahawa sa ibang tao? Okay? Kung ang isang tao may measles, kaya nang ihawa sa 15 other people. Itong novel corona is roughly 2.4, 2.5 lang. Meaning to say, one person infected with this novel corona, 3 tao lang yung kaya ng ihawa. So, see the comparison? Yung mga tao masyado lang nahahype, no? Or natatakot because of, some wrong information sa social media. Well, in fact, we have more diseases pa na dapat mas tayong matakot.
Learn the ways on how to avoid getting 2019 novel coronavirus when Dr. Zon TV returns.
Pumanaw na ang ophthalmologist na si Li Wenliang, ang doktor na unang nagbigay ng warning patungkol sa 2019 novel coronavirus sa China. Base sa official statement ng Wuhan Central Hospital, sinubukan pa ng mga doktor na i-resuscitate si Li Wenliang, pero pumanaw na ito dakong 2:58 AM ng February 7. Si Dr. Li Wenliang ay na-confine noong January 12 matapos mahawa sa isa sa kanyang mga pasyenteng nagpositibo sa 2019 Ncov. Ayon sa mga ulat, last December 30 ay sinabihan na ni Dr. Li Wenliang ang kanyang mga kasamang doktor ng impormasyon hinggil sa 7 pasyenteng nagmula sa local seafood market sa China na na-diagnose ng isang SARS-like illness at ang mga ito ay isinugod sa ospital kung saan siya nagtatrabaho. Pero inakusahan ng mga pulis ang 34 anyos sa doktor ng umano'y pagpapakalat ng maling impormasyon kaya isinailalim siya sa investigasyon. 2 linggo matapos ang pagbibigay ng babala ni Dr. Li Wenliang, nagkaroon na ng sunod-sunod na kaso ng 2019 Ncov sa Wuhan, China. Nagpaabot naman ng pakikiramay ang World Health Organization sa pagpanaw ng doktor.
How can novel coronavirus be prevented?
Maiiwasan actually ang itong klaseng infection, coronavirus infection, 2 methods. First, kailangan natin mag-practice ng hand hygiene always. Pag sabi kong hand hygiene, bumahing tayo, okay? umubo tayo, pumunta tayo sa CR or toilet, pumunta tayo sa office, naghawak ng doorknob, ng table or whatever, we should not forget to wash our hands. Kasi hindi natin alam, itong kamay natin, dami palang nahawakan. At yung mga nahawakan mo, may mga virus din, may coronavirus, you do not know. So merely the practice of washing your hand with soap and water, malaking tulong na yun to prevent this kind of infection. Pag walang soap and water, ano kaya gagamitin? Alcohol. At least 70% strength na alcohol o yung mga pocket sanitizer, pwede na yon. Secondly, is cough etiquette. If alam mong may sakit ka at alam mong uubo-ubo ka or babahing-bahing ka, make sure you have a hanky or you use a tissue to cover your mouth. Kung wala kang tissue, wala kang handkerchief to cover your mouth, at least use this part of your arm like this. Then you cough. Or kung talagang wala, like that. See? You do not want to spread yung infection sa iba. You don't want to be selfish, actually, di ba? So, cough etiquette, very important. And may I add the third method? If you are dealing with possible pasyente na pwedeng magkaroon ng ganung klaseng novel corona infection, you're not sure, di ba? It is SOP, standard na yan. When dealing with a possible person under investigation, make sure you protect yourself. You should have yung knowledge kung paano at anong klaseng mask at personal protective equipment ang gagamitin. With these methods, pag practice very well as a habit, we can prevent this infection.
What if I have to go to crowded places? What should I prepare?
Pagpunta sa mga masisikip o matataong lugar, katulad ng mga mall, palengke, as long as wala ka namang sakit, wala ka namang ubo, wala ka namang sipon, hindi naman talagang kinakailangan mag-mask. But if you think wearing a mask mas bibigyan ka ng security blanket, optional naman yon. Hindi ko sinasabing huwag ka mag-mask, no? Optional, it's your choice. But again, wearing mask brings also the responsibility at tama ba ang paggamit ng mask? Kasi baka naman sumusuot ka ng mask. Tapos, paano mo naman tinatapon yung mask? Baka tinatapon mo lang siya elsewhere, no? So, nagkakalat ka din ng infection. So, you should be responsible enough. Kapag sumusuot ka ng mask, you should know how to dispose them properly din. At saka dapat tama din yung pagsuot ng mask. Kasi susuot ng mask yung mga ibang tao, just, joining the bandwagon, parang nakikiuso dahil maraming sumusuot, pero mali naman pala yung technique of wearing the mask. So, I would really not suggest na lahat ng tao mag-wear ng mask. Indications, ano lang ba yung rason, no, para magsuot ng mask? Pag ikaw mismo inuubo-ubo, may sipon, binabahing, you want to prevent yung transmission ng mga droplets mo sa ibang tao. Ito yung pinaka-well-studied. Second is, nasa maraming tao kang lugar, no? Takot ka na yung mga droplets nila mapunta sa'yo. Well, but not very strongly na indication siya. But yun lang naman. If you are working in a hospital, taking care of patients, standard din yan na you should wear the mask. But if just wearing the mask na gusto mo lang or wala lang, no indication to do it.
Is there a vaccine for novel coronavirus?
Sadly, let's talk about the treatment for this one. This is a viral infection. Karaniwan ng mga viral infection, self-limiting. Pag sinabi natin self-limiting, gumagaling siyang mag-isa. Kusa siyang gumagaling. So wala talagang tayong standard or drug of choice na sinasabi kung ano yung talagang dapat ipainom o ibigay sa patients na to. Secondly, how about sa bakuna? Wala pa po tayong naiimbentong bakuna to prevent this kind of 2019 novel coronavirus infection.
Is it true that novel coronavirus will not last long in the Philippines because of its warm climate?
Sa Philippines, we belong to dun sa lapit sa equator, no? So tropical country, mainit. May mga nagsasabi na itong virus, nako, hindi ito tatagal sa Philippines dahil mainit. Mali po yon. Kasi meron na rin po tayong mga bansa, no, na documented belonging sa mga maiinit na klima na meron ng confirmed cases. So hindi siya totoo.
How can parents protect their kids from getting infected while at school?
So para doon sa mga estudyante, no, na pumapasok sa school, ang mga magulang nila probably pwede silang turuan ng cough etiquette. Kapag itong mga estudyante or ang mga anak ng mga magulang merong ubo, sipon, turuan po sila yung tamang paraan ng pag-ubo, turuan din sila ng tamang paraan ng paghugas ng kamay, at dapat malaman din ng mga magulang na kapag ang mga anak nila may sakit, magpa-check muna sa doktor. And please, also, they have to be responsible enough. If nag-travel sila at nanggaling sila sa bansa, uulitin natin, bansang Hong Kong, Macau, and China, make sure na inform din nila yung it's either the principal or yung someone in charge dun sa school because we don't want to be selfish.
Should we worry?
Hindi natin mapapredict ang mga situation for the next few days and weeks, but I can assure yung DOH natin and the Infectious Society, okay? So we are working hand in hand because we want to contain this outbreak na novel corona. Philippines has been through SARS, MERS-CoV. In fact, maganda yung pag-control natin. So I'm sure our Philippines, okay, would be able to control this scenario. So wala namang problem eh. Having 3 confirmed cases is not a hindrance na dapat lahat tayo matakot na. As long as we know the precautions, how to protect ourselves, and not to transmit the infection to others, sapat na yon. So about the 2019 novel coronavirus, ito ay something new, something na bago. Okay? Ang gusto ko lang iparating sa mga audience natin is please do believe dun sa mga DOH at dun sa mga infectious na doctors at dun sa mga reliable na sources. Okay? Do not rely on social media, Facebook, Instagram, o yung mga haka-haka ng mga kapitbahay natin o mga kaibigan dahil we will not help the situation. In fact, napapagrabe lang natin yung sitwasyon. So bottom line is, if merong ubo, merong sipon, merong lagnat, merong history of travel, wag na po mag-atubili, pumunta na sa hospital at magpagamot. Kung kayo ay kinakailangan mag-home quarantine, wag maging pasaway. Kailangan pa rin mag-home quarantine. Pag sabi natin home quarantine, hindi siya pupunta dapat sa mall. Dapat isolated siya sa bahay, wear a mask. Siyempre may pagkain, may tubig, okay? Pero kung magpapakonsult sa doctor, make sure to call the hospital in advance muna to inform. And if itong pasyente would fall under investigation, huwag din maging pasaway at kailangan pa rin magpa-admit dahil ito ay para sa kabutihan ninyo. Okay? So this is a 2019 novel coronavirus, not something na tinatakot kayo. This is something new, but our government, the Department of Health and Infectious Disease Doctors, we're all here to help you out and to help the nation to control this outbreak.